Lupus, a complex and often misunderstood autoimmune disease, affects millions of lives worldwide. Our next guests are not only at the forefront of lupus treatment and research, but they're also playing a pivotal role in lupus education. I am happy to welcome Professor of Medicine, Dr. Diane Kamen, and Program Coordinator Quinnette King with the MUSC Division of Rheumatology and Immunology. Ladies, thank you for joining me today.
Thank you so much for this opportunity.
So I have heard lupus referred to as the great imitator, and I am not too keen on what lupus is. Can you ladies fill me in?
Yeah, absolutely. I will take this one. So yeah, lupus is an autoimmune disease, meaning the immune system, which we rely on to fight off infections and foreign, bacteria, things like that. The immune system turns against your own healthy proteins and cells. And so because of that, the immune system's attacking organs like kidneys, skin, can affect different people in different ways.
Yeah.
So I think that's probably where that term comes, because some people have a lot of joint involvement. Some people have skin, some people have kidney or brain or heart. And unfortunately, there's people that have multiple areas affected. So it can really present so many different ways in different people.
Okay, so do you ladies see that often, when someone is diagnosed with lupus, that there was all these other things that they might have thought it is? It's hard to pinpoint?
Yeah, there's a long delay oftentimes that we see, every day when we talk to patients. They've had symptoms sometimes for years. On average, it can be 5 to 7 years before an official diagnosis is made. And that's a critical window of time, because early treatments could be given. And that's a time when some of the inflammation that lupus is causing damage. And that is irreversible sometimes. So the earlier the better that we can get on treatments. Yeah.
And Quinnette, I've heard that lupus only affects women, but I don't believe that to be the case, right?
Correct. That is not the case. It does affect men as well. It just seems to affect women in a more higher rate than it does for men.
Okay. Why do we think that is?
That's why we're doing research.
Yeah, absolutely.
But autoimmune diseases in general affect women more than men. But yeah, there are, children can be affected by lupus, but sometimes we see older adults affected by lupus. It is lifelong. So once you have a diagnosis, we don't yet have a cure.
Yeah. But you have treatment options.
We have treatment options.
Okay, perfect. And you guys are doing an education event that you guys are hosting, which I think is incredible, because we hear lupus about it a lot, but I don't think a lot of people are as educated as we need to be. Quinnette, can you talk to me a little bit about this education event?
Yes, so it's going to be our 12th annual Lupus Education Day event, happening October 14th from 9 a.m. to 2 p.m. We'll also have the link for registration, but it's a very critical point where we could get more individuals in to talk more about lupus, to get a little bit more understanding about lupus, and to talk to some experts in lupus and get questions answered that maybe they have or maybe their caretakers have, and just haven't been able to make an appointment with them to ask those questions.
Okay, and so why do you ladies think that community education for even people who don't have lupus, why that is so important?
I think you said it right at the beginning about it being a great mimicker, imitator. It's a mystery a lot of times, the first symptoms that people have. So if you have lupus in your family, you are at slightly higher risk. But a lot of the research I do, and a lot of what we think is causing lupus is environmental. So I think finding out about preventive measures, finding out about those early symptoms that might prompt you to go see your doctor and ask for screening tests. There's a lot that can be done early that you don't really want to let get out of hand.
And you mentioned environmental. Is there a certain part of America or the world where lupus is more prominent than others?
Well, we are in a cluster here along the coast, but it's multifactorial, we like to say, because lupus is more common in African Americans, especially African American women. So, here in the Low Country, we follow, several thousand patients, come through rheumatology, but then you think about all the people that are at risk of lupus. So yeah, we're we're unfortunately in a bit of a hot spot for lupus
Yeah.
here, which is why our center, really focuses on it.
Yeah. And the education is so crucial, and what you guys are doing is amazing. And this event is for patients, family members, friends of people, or people who just want to learn more about lupus. Once again, it is Saturday, October 14th at the MUSC Drug Discovery Building. And if you go to musc.edu/lupus, you will be able to find the link to register. Ladies, thank you so much for joining us.
Thank you
for having us.
Thank you.
We're back after this.